All right. Are we ready for the jury?
Yes, Your Honor.
Okay. Good morning, ladies and gentlemen. All right, please be seated. Next witness.
Good morning, Your Honor. Mr. Depp calls Kate Moss to the stand.
All right.
She will be appearing on your screen.
All right, ma'am, can you hear me? Yes, can you count to 5 for me?
1, 2, 3, 4, 5.
Thank you, ma'am. If you could raise your right hand. Do you swear or affirm to tell the truth under penalty of law?
I do.
Thank you.
Good morning, Ms. Moss, or I should say good afternoon, your time. My name is Ben Chu from the firm of Brown Rudnick. Would you please state your full name for the record?
Kate Moss.
Ms. Moss, where do you reside?
London, England.
From where are you testifying today, Ms. Moss?
Gloucestershire, England.
Ms. Moss, do you know Johnny Depp?
Yes, I do.
How do you know Mr. Depp?
I had a relationship with him.
Did there come a time when you and Mr. Depp had a romantic relationship?
Yes.
For how long, Ms. Moss, were you and Mr. Depp a romantic couple?
From 1993 to 1994 to 1998.
Ms. Moss, did there come a time when you, while you and Mr. Depp were a couple, that the two of you took a vacation together to the Golden Eye Resort in Jamaica?
Yes.
What, if anything, happened when you were in Jamaica with Mr. Depp?
We were leaving the room and Johnny left the room before I did, and there had been a rainstorm, and as I left the room I slid down the stairs and I hurt my back.
How did you...
And
I apologize, Ms. Moss. Please continue.
And I screamed because I was because I didn't know what had happened to me and I was in pain, and he came running back to help me and carried me to my room and got me medical attention.
Did Mr. Depp push you in any way down the stairs?
No.
During the course of your relationship, did he ever push you down any stairs?
No, he never pushed me, kicked me, or threw me down any stairs.
Ms. Moss, have you ever before today testified in any kind of court proceeding?
No, I have never.
Why did you decide to testify today?
Objection, Your Honor.
All right.
That's beyond the scope of what we just talked about.
All right, I'll sustain the objection. All right.
Thank you, Ms. Moss. We have nothing further at this time. We greatly appreciate your taking the time to testify.
All right, any cross-examination?
No, Your Honor.
All right, you're free to go. Thank you, Ms. Moss.
Thank you very much.
Thank you very much. Thank you.
All right, your next witness.
Your Honor, we're calling Dr. Shannon Curry.
Just give us a moment. to move the TV. All right, Dr. Curry. Good morning, Mr. Dennison.
Good morning, Your Honor. Plaintiff calls Shannon Curry, Dr.
Yeah.
Shannon Curry.
That's fine. Ma'am, you're still under oath, so please have a seat, doctor.
Good morning.
Good morning, Dr. Curry.
Good morning.
Can you remind the jury who you are and what you do?
Sure. I'm Dr. Shannon Curry. I'm a clinical and forensic psychologist, and I'm here today to rebut the testimony that was provided by Dr. Hughes.
Which of the opinions rendered by Dr. Hughes do you intend to rebut?
So generally speaking, there are three main categories that I'd like to talk about today. So the first is that Dr. Hughes misrepresented the tests and the results that she utilized in her evaluation. She misrepresented my testing and the results that I obtained in my evaluation. And she communicated in a manner, provided testimony in a manner that presented essentially her own opinions and the self-report of Ms. Heard as facts.
Okay, the first category you talked about was a misrepresentation of her own test methods and results. What do you mean by that?
So Dr. Hughes she stated that she administered 12 tests. In actuality, she used 8 checklists. About half of those were symptom checklists. The other half were checklists about experiences that people can have with domestic violence. And those are not appropriate for forensic settings. They are easily exploited.
Other issues that you intend to address relative to misrepresentation of own results?
Yes, so in addition to using these checklist measures, which are easily exploited in a forensic context, they're developed for research or treatment only. She also stated that these checklists revealed things that they simply cannot reveal, especially in this context. Let's see. She also misrepresented information, clear indications on several of the objective measures that she offered. And there were indications visible that Ms. Heard had essentially engaged in what we call response distortion. So clear indications of exaggeration on one of the measures that's specific to PTSD, clear minimization of symptoms intentional on another more broad personality and psychopathology-based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard, and she did not administer the test appropriately. So she left major components blank. She didn't apply the scoring rules that are clearly outlined with the test, and yet she diagnosed Ms. Heard with PTSD based on that assessment.
What about Dr. Hughes's use of the personality assessment inventory?
So of the tests that Dr. Hughes administered, 2 would be considered. Of those 12, 2 would be considered what we call forensically relevant instruments, meaning that they're objective enough and they provide us with some information about how the examinee approached the test, that it would be appropriate for this setting where the examinee is going to have a natural incentive to present themselves in a way that benefits the outcome of their case. Now, on the PAI, there were clear indications that Ms. Heard was responding and obtained scores in a manner that's consistent with individuals who have a personality disorder. And there was also an indication that several scales, we call this a configuration. So you might have one main scale that you notice is elevated, then you look for additional subscale information to get additional information on what could be elevating that scale. And there was a configuration that showed that even though Ms. Heard had moderately elevated one of the scales that can be associated with trauma, that elevation is better explained by childhood or distant traumatic experiences like the complex trauma Ms. Heard reported experiencing growing up.
Okay. You said that Dr. Hughes utilized checklists that are not appropriate for forensic analysis. Can you explain that?
Yes. So, as I said, in any sort of forensic context, whether it's a civil or a criminal matter, a person who's being evaluated is going to have major incentive to present in a way that benefits the outcome of their case. So you always approach the examination, I believe Dr. Hughes said, with a healthy dose of skepticism, but that alone is not enough. We have to operationalize that. So we actually have to administer very comprehensive objective tests that either control for attempts to manipulate the test results or reveal attempts to manipulate the test results, so that we're not just blindly accepting the results or the self-report of the examinee.
How many tests were administered by Dr. Hughes?
She said that she administered 12 tests.
How many of them were appropriate for forensic physical examination?
So the trauma symptom inventory is appropriate. It's an objective measure, and it does have 2 primary scales that look at how the person approached the test. The personality assessment inventory is an excellent test. It is a broadband measure, meaning that it captures not only symptoms of mental illness, but also general personality traits. That also gives us pretty detailed scales similar to that one test I administered, the MMPI, that tells us a lot of nuanced information about the way the person approached the test. She also administered a malingering screen that can be very, very useful, but not in this context. So it's called the Miller Forensic Assessment Symptom Test. It's a brief set of questions that you ask the examinee, and it's been shown by research to be extremely effective at identifying an examinee's attempts to fake a severe mental illness or psychosis. And psychosis is when somebody loses complete connection with reality. It's excellent for that purpose. It's actually been shown in the research to not be effective at all for identifying a respondent's attempts to fake PTSD, anxiety, or mood disorders. The questions are just too odd for somebody who has the wherewithal to be trying to have PTSD to endorse. They see through it. So she used that. That's a fine test, but not appropriate for this context.
Of the various tests that she administered, how many were these checklists?
8 of them.
All right, and what are you talking about specifically?
Okay. So I had mentioned that there were 2 main categories of checklists she used. The first is the symptom checklists. Those included the Beck Depression Inventory. It's a brief inventory of items that essentially show all of the symptoms of depression that a person might have, and you rate which level of severity you have for each question. She also gave the Beck Anxiety Inventory, very similar, but just with questions about anxiety. She gave the Mood Disorder Questionnaire, which is a very brief, again, checklist. It shows symptoms of bipolar disorder. Bipolar disorder is a mood disorder where you might have an extended manic episode and then a very extended depressive episode. And then she gave the post-traumatic stress disorder checklist, and that is a screening instrument only. It contains every single symptom of PTSD. So there's a secondary danger here too. When you think about it, given that PTSD is the most frequently feigned and claimed diagnosis in civil courts, if you're handing somebody a checklist that lists every single symptom of PTSD, you're essentially teaching them all the little nuances that we're looking for to give that diagnosis. So she gave that to Ms. Heard. Ms. Heard endorsed most of the items, and Dr. Hughes diagnosed her with PTSD and substantiated that opinion by Ms. Heard's checking those items on the PCL-5.
Were there another group of checklists that Dr. Hughes used?
Yes, so she also, and I forgot one on the last because I don't think of it as one, but previously I'd explained, and I do not expect you to remember, it's called the Life Events Checklist, which is just an inventory of experiences a person may have gone through that are traumatic. Dr. Hughes also used that, and that's appropriate to use before the clinician-administered PTSD scale, the gold standard CAPS-5. However, she administered this long ago before she gave the CAPS-5. Now that going on to the second group, there were 3 checklists that she gave that are specific to abuse. And the first she gave, the Danger Assessment Scale, was actually developed for use by nursing staff in an emergency room setting, specifically for female victims of intimate partner violence. The purpose of this is important because our forensic ethics, our psychology ethics, talk a lot about relevance. Is the test relevant to the purpose? And the Danger Assessment Scale, its initial purpose is completely different. This was developed to show high risk factors for dangerousness and pretty much to help a female who is in an extremely abusive partnership, who is in the emergency room with extreme injuries, to stop rationalizing, because if she has to check off all the things that have happened that year that have been dangerous, does he own a gun, has he, I won't go into all of them, but the more she checks off, the more likely it is that she might realize that she is in imminent danger, and then accept resources offered by the hospital and social work to protect her. That was the purpose of this scale. It was never intended to be used as a retrospective measure to look back in time and find out whether abuse was occurring based on one person's report years later in a litigation. She also gave the Conflict Tactics Scale, revised, the second edition. Similarly, this scale was developed for research purposes, to research family violence. Again, there is no control for exaggeration or minimizing. It was just given to research participants anonymously so that we could get data on the prevalence of abuse and how abusive dynamics work. And on that, there's 39 questions where the respondent indicates essentially certain abusive behaviors they may have engaged in, and then 39 where they indicate behaviors their partner might have engaged in. And obviously, you can understand that in a forensic setting, the respondent is likely to put a very minimal amount of behaviors they engaged in, and then extremely increase the number of behaviors their partner might have. And then lastly, let's see, the abusive behaviors observation checklist was the third checklist she gave. This one has not, there's no known research even on its effectiveness for what it was developed. It's a theoretical, very brief checklist that was meant to be used for therapy, where an individual who had experienced domestic violence could essentially read through some of the behaviors that constitute violence that they might not have been aware of. And if those behaviors applied to them, or if some of those coping strategies were ones they utilized, they would check that off, and then they have a way to talk about it because now it's been put to words. Again, this is similarly problematic if you're in a civil litigation, the person's motivated to have their results be consistent with a claim or an allegation of intimate partner violence and an allegation that they've been severely harmed, then they could simply just check off more. And not only that, but checklists like this one specifically give a lot of nuanced information about what clinicians might be looking for when they're assessing whether violence was present or whether the person's self-report is consistent with a genuine self-report of having been victimized. They're given all that information that we might be looking for.
Can you talk specifically about Dr. Hughes's use of the, I think you called it the PCL-5?
Yes. So the PCL-5 is the post-traumatic stress disorder checklist. This is different, not to be confused with the CAPS-5, which I've talked about previously as being the gold standard. The PCL-5 was developed by the National Center of PTSD. It's intended for treatment. So if I were, for instance, working with a service member who I know had been in combat, I would probably give this as a standard with my intake. Before we do the diagnostic interview, it kind of gives me a read on how somebody who's there for treatment, who we assume can be taken at their word because if they give us correct information, they're going to get an appropriate treatment. And if they give us incorrect, they might not get the treatment they need. So I would give this checklist to them, and then if they recognize some of those symptoms of PTSD, they could check it off. And that would probably indicate to me that I need to then do the next step. If they're checking off more items than not, I would probably decide to administer the clinician-administered PTSD scale, that gold standard interview, to find out more about a diagnosis.
The last thing is what everybody refers to as the CAPS-5?
Yes, the CAPS-5.
All right. What about, well, you talked about forensic use. What do you mean by that?
So when I'm talking about forensic evaluation, that's an evaluation that isn't done for therapy or treatment. It's specifically to assist the fact finder, to assist the judge or the jury in the court by providing information about the psychological status about an individual. And that's an important delineation too. We are not psychologists. I wish we were mind readers. I wish we had a crystal ball and could find out whether intimate partner violence occurred and look back in the past. But it's nothing like that. Really, it's a lot less interesting. We look at data. We have to control for those response biases. And then we also are looking at functioning, which is really the bottom line of the assessment. Did the person have a change in functioning from before the alleged trauma, or in this case, the alleged IPV, to after? Is there a decline in the way they're going about their lives?
Objection, Your Honor, may we approach?
All right.
Dr. Curry, let's look back at some of those domestic violence checklists that you were talking about.
Okay.
And did you see any problem with the use of those?
Yes.
What problems did you see?
Well, Doctor, first of all, they shouldn't be used. So we do have professional standards that require that we utilize instruments that are relevant and appropriate for the particular setting, and that we substantiate our opinions based on data that is reliable from tested, accurate, reliable tests for the purpose. So there's that. It's inconsistent with the ethics, and essentially they just shouldn't be used. They don't provide us with the robust information that it would be expected in such a high-stakes setting.
Would you have expected Dr. Hughes to comment on the limitations of the checklist she was using?
Yes. So first of all, Dr. Hughes provided opinions based on these checklists. So she referenced especially the danger assessment scale several times throughout her testimony, stating that Ms. Heard was in a very dangerous situation. We also have an ethical guideline and a professional standard as well that indicate that whenever there is question about the reliability and the validity, and in psychology we use the term validity to talk about accuracy, of any of the methods that we're using to collect data, we clearly communicate not only that there are limitations to our opinions, but we also need to provide the fact finder with information about what the potential implications or impact could actually be. So, for instance, if we use a scale that's idiosyncratic for the purpose, but we would first need to explain why we made that decision to not follow standard procedures. And then we would need to explain the use of this scale might introduce some potential exaggeration of this symptom, and so I'm trying to control for that way, but that was one of the limitations of my opinion. You have to make it very clear. Transparency is really at the center of good science in general.
You talked a little bit about ignoring response distortion. What is response distortion?
Response distortion is a term that speaks generally about an examinee approaching a test and providing answers that are either exaggerated or minimized, but in some way an inaccurate representation of their current mental status or their experience.
What test do you believe that Dr. Hughes failed to acknowledge response distortion on?
So she administered the personality assessment inventory, which is similar to the test I gave the MMPI-2. It's that general broadband measure of psychopathology symptoms and personality traits. It includes several scales that are very good at detecting either exaggeration, minimization, or even trying to claim that you have unusually good qualities. On that test, there were clear indicators that Ms. Heard, very similar to the way she approached my MMPI, engaged in defensiveness. And in fact, there's a function that you can look at. So you have that main scale elevation, we call it positive impression management, was elevated. And then, because we want to make sure that somebody isn't elevating that scale just because they have such well-being, there are additional configurations of scales that you can look at to find out what's going on. And so the Cashel discriminant function is sort of the name of one of these configurations, these equations that are done. And she was highly elevated on that. In fact, that elevation tells you that no, this isn't accidental. This isn't because she's just doing so well in life that she has an extremely, extremely low amount of problems. No, this is an intentional over-reporting, or I'm sorry, an intentional effort to minimize any appearance of having problems.
Now, you may have addressed this, but there was a reference to malingering.
Yes. So what's interesting about Ms. Heard's approach to different tests is that it seems to be influenced by what we call the face validity of questions on the test. So if a test looks like it's measuring PTSD, you see exaggeration on her validity scales. If the test has less face valid questions, for instance, the personality assessment which Dr. Hughes administered, the MMPI-2 which I administered, where she can't quite figure out what the questions are asking, they seem really banal in general. On those, you see extreme defensiveness, minimization of any potential pathology, essentially presenting herself as perfect and free of any mental illness or personality disorder. But on the trauma symptom inventory, which Dr. Hughes administered, that was the one that I previously indicated for ease of explanation. When the test results come out for how the person approaches the test, that test itself prints it as a percentage. And there's a really excellent scale for finding out if a person is exaggerating their symptoms of PTSD. It's called the atypical response scale. And the TSI-2 is the revised version of this test, and that scale was improved this time around to really try to be a clean indication of, is this person exaggerating? And it puts quite high questions in the test that are so unusual. They might sound like PTSD, but even the most severe cases of PTSD don't have these symptoms. And so somebody who's intentionally trying to exaggerate PTSD, or possibly unintentionally, but nonetheless, who's exaggerating it, is likely to endorse these items, even though they're not real PTSD symptoms. Ms. Hurd scored so highly on this that even if there is, although Dr. Hughes correctly said there tends to be a negative skew when people have the high levels of distress that's associated with PTSD, so sometimes people score higher on this even when they do have PTSD, she scored so high that that is effectively ruled out as a possibility.
Okay. What about Dr. Hughes's administration and use of the CAPS-5?
Okay, yes. So Dr. Hughes had diagnosed Ms. Hurd with PTSD back in 2019 when she began testing her. It wasn't till 2 years later, more than 2 years later, 10 days after I administered the CAPS-5 with Ms. Hurd, that Dr. Hughes held an impromptu evaluation session remotely with Ms. Hurd and administered the CAPS-5. She had previously diagnosed PTSD without using what we consider to be the gold standard PTSD diagnostic interview. And again, when we're doing a forensic evaluation, it is an important responsibility, and part of our ethics and professional standards are that we document everything to allow for transparency and full judicial scrutiny. And Dr. Hughes administered incorrectly. She left huge sections, very relevant sections, blank. There's no way to understand why she scored it as high as she did based on the information that's provided. You're essentially supposed to notate the examinee's responses as verbatim as possible to explain your reasoning and implying their scoring procedure. It's a standardized test, and if you don't follow those standard procedures, it's completely invalid. Not only that, but it looks as though Dr. Hughes further invalidated it by trying to show that she had assessed for the childhood trauma impact, and she had said that she went back and asked the childhood question, but you can't do that. If you're assessing for two separate periods of one's life to find out the relatedness to PTSD, you do two separate CAPS interviews, period. You don't create your own question system. That is non-standard administration of the test, and it invalidates it.
All right. You also mentioned, with respect to the PAI, or the Personality Assessment Inventory, that Dr. Hughes failed to mention some elements. What did she fail to mention?
Oh, okay. So on the personality assessment inventory, so first she failed to mention that there were clear indications of response distortion. She also failed to mention that Ms. Hurd scored in her score profile, again, so there are main scores. She did elevate a score for the borderline personality disorder sort of section, but that in and of itself would not indicate a diagnosis. However, the configuration of her scores overall is consistent with that. And in fact, it's one of the diagnostic suggestions given by the test itself. And then also there's a configuration around Ms. Heard's trauma responses on that particular test, which demonstrates that it is more likely that those symptoms were reported in relation to something in the distant childhood. It's more consistent with childhood chronic abuse than present circumstances or recent circumstances.
Okay, I think you said in addition to the issues with her own testing, Dr. Hughes misrepresented your results.
She did.
Can you tell us how?
So I would say the main issue was that she said that Ms. Heard obtained a normal profile on my MMPI-2.
All right. How do you disagree with Dr. Hughes relative to the profile?
Okay, so the profile was not normal. So Ms. Heard already had subtle elevations just by the test by itself as it came out. There were subtle elevations, but they were elevations that if the validity scales hadn't been as elevated as they were, you might have said this person has some traits, but this isn't necessarily at the level of a true pathology. However, Ms. Heard elevated a scale that essentially is a defensiveness scale on this test. And when you're giving this test, you always are mindful of different norms or groups who may have similar profiles. And there are certain groups of litigants who tend to elevate this scale as well. So I had that in mind. However, Ms. Heard elevated this so much that it was far beyond the mean for the litigants that are known to have the highest levels of this scale, this defensiveness scale. And when this scale is elevated to the level that it is, you automatically understand that it is very likely that those clinical scales, I keep doing this because I'm seeing it in my head, it looks like sort of an ECT. It's sort of these peaks you see on a graph. And when you see these peaks, and you have this huge peak over here for the defensiveness scale, what you know is that these peaks are artificially, they've been lowered or suppressed based on the respondent being so defensive. They still detected what's likely there for her, but it's not as high as it should be. So you make an adjustment. And the recommendation is that anything at 60 or above, we call it a T-score of 60, or above is considered significant. Ms. Heard's were already over 60. Some were quite higher than that. And then you see a very clear profile. And that was how I got that. I had mentioned a 3-6 code type. Now, the test does its own correction also for some of the scores, but not the ones that are her main code type. With the test correction, she had a 1-3-6 code type, which is very similar.
What is a 3-6 code type?
A 3-6 code type is something that has been researched and found to be highly correlated or probabilistic of certain behavioral tendencies and personality traits. And the traits with a 3-6 code type tend to be marked by a lot of externalization of blame, a lot of denial about one's own personal faults, intentional or not intentional, but just extreme denial, hostility that is strongly controlled and suppressed. The person may not even realize how hostile they are, but family members, those closest to them, are very likely to report that they lose their temper, and when they lose their temper, it explodes. We have sort of what we call a cookbook for these code types, which will provide you with all the information that's been researched to be associated with them. And our cookbook actually states that 3-6 profile specifically tends to be associated with cruel and ruthless behavior, particularly to those who they perceive as less powerful than them and subordinates.
Describe for the jury the review process that you went through relative to the MMPI.
So I conducted a very methodical analysis of the scores. I do this for every test, and I also did it when I was reviewing Dr. Hughes's scores. So what you haven't seen that's in Discovery is that I created a 25-page outline just of her scores with, and it's sort of a table. So I'll put the score, I'll do it in sections so that I can understand different groupings, different research studies, and I start with looking at all the validity scales. So I put in the score, and I'll even color the table to show me if it's kind of in the high zone, moderate zone, or low. And then if it's low, is it a significant low score, or is it just low so it doesn't mean anything? And then in the right side, I put all the research data that I found on this particular scale score. And so I start with the validity scales, the way the person approached the test. Then I go down to essentially, we call these the first factors. So their overall sense of well-being and how well they cope. On this, actually, Ms. Hurd's, she endorsed scores or endorsed items that were the opposite of PTSD. So really saying that she feels free of distress and that she views herself very well. So then I go down to control, self-control, loss of control, coping abilities, and I put in the scores that are associated with that in the research and the test development. Then I go down to clinical and personality pathology, and I look at all the scores that are significant there, first with the top level main scores, then with all of the different sub-scores, again, citing the research, the meaning, the level of elevation, and what that means. And then I do comparison with different research groups. So for Ms. Hurd, I did a section that looked at all sorts of different scores that have been implicated with a PTSD presentation to see if any of those were consistent. I can't remember how many there were. I think I put 13 on there, but I could be wrong. But I believe that there was only one that could even be, in some research, is sometimes associated with it, but it was general anxiety, which turned out to be more trait specific. I looked at the scores that are typical of women with IPV. Hers were not consistent at all with those. I looked at the scores that were consistent with people who are frequently in litigation. Hers actually were very highly correlated with those. That tends to be also consistent with a 3-6 code type, and the reason for that is believed to be that they tend to perceive themselves often as victims who need to avenge wrongs.
Were there other results you believe Dr. Hughes to have misrepresented? For instance, the TSI-2.
Yes. So Dr. Hughes generally said that testing supported PTSD and that there was an etiology for her trauma of intimate partner violence. She did reference that essentially I can't remember if she said that the trauma symptom inventory indicated PTSD, but she did say that the elevation on that validity scale is consistent with PTSD, and that's simply not true. That scale was designed and has been tested and shown to be there to show when somebody is endorsing extremely unusual items that are not consistent with PTSD. And even though when some people are experiencing PTSD, their distress level is so high that they'll engage in what we call a cry for help, and they may sometimes exaggerate distress. Again, when you're looking at scores as high as Ms. Hurd's, and then you're not seeing indications of PTSD in the more subtle tests where she doesn't know what she's endorsing, it's good evidence that her over-endorsement on that one test is because of the reason the scale was made, to detect exaggeration and feigning of symptoms.
Is this the test that resulted in the 98th percentile score?
Yes, on that atypical response scale.
And what does that 98th percentile score represent?
So that 98th percentile score just represents that among 98% of people who take that test would not have endorsed. She scored more of those unusual items that are not consistent with PTSD than 98% of people who have ever taken that test.
Does that relate to this concept you talked about before called feigning?
Yes.
What is feigning again?
Well, feigning is essentially exaggerating symptoms of a disorder.
I think the third thing you indicated you were going to talk about was self-reports and personal opinion as facts. What are you talking about there?
So in any science and in psychology specifically, it's really important that we use precise language and we say what we mean, and we do not present opinions as facts, because when you are in the role of an expert witness, or an expert in any setting, essentially a layperson may not be able to detect the difference between something that is a personal opinion that you're giving versus something that is substantiated by research data, test data, reliable test methods. So our ethics talk about, especially the specialty guidelines of forensic psychology, the responsibility we have to distinguish between data, then inferences we're making from that data, what the data can mean, sort of like those tables I do. I put the data, the inferences based on the research, and then what my ultimate opinion is, integrating all of that data. And it's very important that we clarify that to the fact finder, to the judge, the jury. That's our responsibility, that we do not cloak personal opinions or the self-report of an examinee as an expert fact or somehow scientifically based when it is just a personal opinion or self-report of an examinee.
What do you mean by self-report?
The self-report is essentially what the examinee tells you during the interview.
Okay. When did Dr. Hughes do this most?
She did this most when describing instances of alleged IPV. And there's also an issue there because one of our ethics also discusses the importance of relevance and withholding, essentially constraining our testimony to the data and not including private information, personal information that unnecessarily compromises the dignity of any of the litigants. She provided a lot of what was Ms. Heard's report to her, the allegations of abuse, when describing Mr. Depp, who she had not examined, when describing Mr. Depp's behavior, his motivations. I believe she used the word obsessive jealousy quite a few times, talked about Ms. Heard being in a highly dangerous situation. These are simply things that we cannot detect based on testing and a psychological evaluation. We have to evaluate the person, we have to get consent, and we can only describe an individual, not whether or not IPV has occurred. And we certainly shouldn't go into explicit details about sexual encounters or other things that are highly prejudicial, shocking, and hard to forget.
All right. Dr. Hughes says that Ms. Heard has PTSD. Do you agree?
I do not.
Why not?
The results of my multi-method comprehensive evaluation based on carefully selected, researched, relevant test instruments, based on comparing those instruments to Ms. Heard's self-report, observing Ms. Heard's behavior over 12 direct hours of assessment, reviewing copious notes from prior therapists who indicated symptoms in their notes, reviewing the notes of Nurse Filati, previously Nurse Borum, who spent, I believe at one point, almost 2 months with Ms. Heard daily, reviewing the notes of her treating providers, all of the legal documents and discovery. There was no evidence of PTSD.
How is evidence of PTSD generally exhibited?
So really the bottom line in a forensic psychological evaluation is a change in functioning. That's what we're looking for. Again, I said we don't have a crystal ball. We're not wizards. We can't get into somebody's head. What we're looking for were there identifiable changes in the way the person engaged in their world. Were they able to keep a job? PTSD is an extremely disabling diagnosis. When a person has true PTSD, it is difficult for them to work. You'll see unemployment, job loss. It causes extreme levels of distress and impairment. There's divorce, there's isolation and estrangement from children, from family members, extreme alcohol abuse, often a string of sudden DUIs when the person never had any before. They become homebound, they can't go to the store. They're certainly not going to events They're not having success in their film career, usually. They're not exercising every day, pursuing their hobbies, being avid readers, obtaining level 3 sommelier training, having dinner parties with friends, speaking to public groups. Those are just indications of very high functioning. And when you're looking for a decrease in functioning over time, that is inconsistent with that decrease.
What about Dr. Hughes' suggestion that Mr. Waldman's statements served as a trigger for Ms. Heard's PTSD?
All right.
Dr. Hughes had suggested that perhaps Ms. Heard's PTSD was somehow triggered. What's your view on that?
I would say that it can't be triggered if PTSD isn't present.
Thank you very much, Doctor.
All right. Cross-examination.
Dr. Curry, I just want to make sure that we all remember, you're not board certified, correct?
No, I'm not.
Okay. And you've been licensed for how long?
I've been licensed for 10 years.
Okay. And you are being paid by Mr. Depp's legal team to be here, correct?
Yes.
How much have you charged so far?
I actually don't know.
Over 100,000?
I truly don't know. I don't do my own books.
Over 200,000?
I don't know.
Over 300,000?
That would be way too much, but I do not know.
Okay. Now, just so that we all remember, you had dinner at Mr. Depp's house for 3 to 4 hours with Mr. Depp, Mr. Waldman, Mr. Chu, and Ms. Vasquez, correct?
I was interviewed. I asked if there was anything I could eat because at about 3 hours I started to get hungry. Mr. Depp then offered to order takeout for the entire team.
So you had dinner at Mr. Depp's home with Mr. Waldman, Mr. Chu, Ms. Vasquez, and Mr. Depp, correct?
Yes.
And you had drinks as well, correct?
I actually don't know. I do remember that there were drinks.
Do you recall testifying earlier that you did have a drink, a mule something?
No, I remember testifying that there might have been a mule, a Moscow mule.
Okay, thank you. We didn't have animals there as well, right?
No animals.
Okay, that's good to know. And you talked about transparency. I just want to make sure you had several designations, expert designations and reports in this case, correct?
Yes.
And in not one of them did you disclose that you had dinner and drinks at Mr. Depp's house for 3 to 4 hours with Mr. Waldman, Mr. Chu, and Ms. Vasquez. Is that correct?
Ms. Bredehoff, you're mischaracterizing what occurred.
Dr. Curry, please answer the question. Not once did you disclose this in any of your reports,
I did not
correct?
disclose that I was interviewed as that standard procedure.
But it's true that you have never gone to a client's house to be interviewed for an expert witness position, correct?
Yes, because I never had a client that was essentially homebound because of their celebrity status.
All right. And you talked to Mr. Depp for 3 to 4 hours before taking on the role of assessing Ms. Heard and deciding whether she was suffering from any distress, correct?
I did not talk to Mr. Depp. I was talking to his legal team, and he was there to observe.
He was present for the 3 to 4
Yes.
hours. Oh, and are you saying now he just stayed silent and said nothing all day?
I don't recall what he didn't or didn't do. I was answering questions.
Okay. Now, your expertise here is limited to whether Amber Heard suffers from PTSD currently. Is that correct?
Yes, I was tasked with conducting an evaluation to determine
Dr.
Ms.
Curry,
Heard's mental
We're all on
status.
very, very strict time limitations
Okay.
because we've promised to get this case to the jury. So I'd really appreciate if you just answer my question rather than trying to go further.
Sure.
Okay? Thank you very much. Now, after you had the dinner, you then provided a designation in February of 2021 in which you said, and this is long before you ever saw Amber Heard, correct? You said that Amber Heard, quote, exhibits patterns of behavior that are consistent with co-occurring cluster B personality disorder traits, especially borderline personality disorder, end of quote, correct?
No,
No, we went through this before.
we did.
But, and that was on the designation, was it not?
I told you last time that I did not write that.
Okay, and you don't know who did on the legal team, correct?
No.
Okay, and then I also asked you, if you may recall, whether you listened to the audio recording in which Mr. Depp taunted Amber Heard that she had a borderline personality disorder. Do you recall that?
I recall you asking me that, yes.
Did you recall listening to that audio tape?
I don't recall Mr. Depp taunting Ms. Heard. I do recall that he at some point suggested she might have that diagnosis.
Okay, and that was back in these audio tapes back when they were together, correct?
Yes.
Okay. Now, you've never before been asked to testify or serve as an expert with respect to someone who has bipolar disorder, correct?
No, as I previously stated, that's not true.
All right. Let's get you that position. My extra copies were all distributed before. Does everybody have those?
Not up here anymore.
Okay. Then my apologies, but I'm going to go ahead.
Your Honor, can we approach?
All right.
Yes.
Now, you recall testifying in your deposition on March 21, 2022, correct?
Yes.
And you were under oath at that time, correct?
Yes.
And the question I just showed you on page 207, line 5, have you ever been asked to testify or serve as an expert with respect to whether someone has bipolar disorder? And your answer at that time was no, correct?
Yes, I had forgotten that case.
Okay. And have you ever been asked to testify whether anyone has behavioral or characterological conduct that suggests they may be an IPV perpetrator?
I can't, yeah, I may have. It's difficult. After about 250 cases, it's difficult to remember specifically.
All right. And have you ever been qualified as an expert in the area of IPV?
No.
And have you ever been qualified to testify as an expert in domestic abuse or violence?
Domestic.
Abuse or violence?
Yes, that's been a component of testimony.
Right.
Okay.
Line 16 of page 207, have you ever been qualified as an expert in the area of IPV? Your answer on line 20 was no, under oath, correct? Then the next question, have you ever been qualified to testify as an expert in domestic abuse or violence? That and goes into page 208, line 4. The answer then under oath was no. Now, you would agree that the literature is quite clear that trauma-based symptoms such as PTSD or complex PTSD have symptoms that overlap with borderline personality disorder and histrionic personality disorder, yes?
Yes.
Okay. And you would agree that it's important to use valid and reliable measures for an accurate diagnosis, correct?
Absolutely.
Okay. You chose, however, not to administer the structured clinical interview for DSM-5 personality disorders, the SCID. Is that correct?
I did.
Okay. And would you agree that that is a state-of-the-art structured clinical interview?
Not for a forensic evaluation with a sophisticated examinee.
But to determine if a personality disorder is present?
No, not in this setting.
You don't agree with that?
I do not.
And you don't agree that that is the gold standard assessment for reliable, accurate psychiatric diagnosis?
It's a good one, but for treatment settings especially.
Okay. Now, did Ms. Hurd, you said you read all of the treatment records, right?
Yes.
Okay. Do you recall reading the treatment records for the psychologist Bonnie Jacobs, who saw Amber Heard over 5 years?
I do.
And did you see anything in Bonnie Jacobs' notes over 5 years in which she diagnosed Ms. Heard with borderline personality or histrionic personality disorder?
No.
Now, you also saw the notes of Dr. Connell Cohen, correct? Mm-hmm. And you even attended his deposition, correct?
Yes.
All right. And he saw Amber for roughly 2 years. He was part of the Dr. Kipper connection, mm-hmm. right?
Yes.
Correct? Okay. And did you see anything in Dr. Cowan's notes, and did he say in his deposition that he diagnosed Amber Heard with borderline personality disorder or histrionic personality disorder?
I saw the symptoms clearly delineated throughout his notes and in his deposition. He does not use diagnoses, so he would not have diagnosed her.
He said specifically in his deposition he did not diagnose her with that, correct?
Yes, and he also specifically stated that he does not use diagnoses.
All right. And you also have seen Dr. Banks, Dr. Amy Banks, the psychiatrist, her deposition, correct?
Yes.
And did Dr.
Not
Anderson,
her deposition. I reviewed her notes in the transcript.
all right. Did Dr. Anderson diagnose Ms. Heard with borderline personality disorder or histrionic personality disorder?
I don't believe she provided any diagnosis since she was a couples therapist.
All right. Now, you've said quite a bit about Don Hughes, but do you remember how many years of experience Don Hughes has in IPV and domestic abuse and violence?
I know it's quite a bit.
Extensive. And she is board certified, correct?
Yes, she is.
All right. And she spent 29 hours of examination with Amber Heard. Did she not?
Yes, mostly
Okay.
interviewing.
All right. And she interviewed her therapists, Bonnie Jacobs and Conan Cowell, correct?
Yes.
And she also interviewed Amber's late mother.
Yes.
Okay. And she administered 12 different tests over the period of that time, correct?
Well, as I said, the majority of those were checklists, which are inappropriate for the forensic setting.
I understand that's what you say, but she administered 12 different tests, correct?
If you want to qualify them as tests, sure.
Okay. And so you disregard, no, I'm not even going to say that. Okay. Let's go to the CAPS-5 and PTSD. Now, you assessed Ms. Heard's traumas in her life, correct?
Yes, I did give her an instrument to assess for any trauma exposure throughout the entire lifespan.
Yes, it's fine. And you wrote that Ms. Heard's exposure to a traumatic event, namely one of the sexual assaults by Mr. Depp, more than satisfied this requirement. Did you not write that in your notes?
That is not what I wrote in my notes. Do you have my notes? So we
And
can
you
look at them?
administered a structured clinical interview based on that trauma, correct?
Not exactly. It's not quite right.
Okay. Now, Dr. Hughes administered a full intimate partner violence assessment, correct?
That's not a psychological assessment. We can't assess for intimate partner violence. That's an event.
Dr. Hughes administered a full intimate partner violence assessment,
She
correct?
stated that, and that's actually something I'm rebutting today.
Okay, and you reviewed her psychological testing,
I
correct?
sure did, yes.
Okay, and are you aware that in September 2019, Ms. Heard had a trauma-based symptom on many of those valid tests?
Can you be a little bit more specific? Many of those valid tests, which tests are you talking
Do
about?
you have a recollection of that, September 2019?
She administered all of her testing in September 2019, so I'm not sure which one, except for the CAPS-5, which was 10 days after mine in 2021.
Now, Dr. Hughes clinically evaluated those symptoms and established that Ms. Heard does have PTSD from the totality of the intimate partner violence by Mr. Depp, correct?
That's what she stated, yes.
Okay. Now, Dr. Anderson's clinical notes that said Amber had come to
Objection, hearsay.
I haven't even asked the question yet, Your Honor.
Are you going to read her notes?
Well, no, actually, I wasn't going to read her notes. I was
okay.
going to ask a particular question.
Okay.
You talked about danger. Do you recall that in your testimony?
Yes.
All right. Now, if a patient comes to you as a couples therapist with two black eyes, would you assess that there may be a potential danger there?
Sure.
Okay. Did you read Dr. Anderson's notes?
I believe I did.
Now, you administered the Minnesota Multiphasic Personality Inventory 2, the MMPI-2. Do you recall that?
Yes.
And you used that to determine whether Amber had PTSD, right?
Not by itself, but it was a part of the data.
Okay. And in the 60 to 70 T-score range for that test, which, quote, deliberate attempts to mislead are uncommon, end quote, isn't that correct?
Sorry, could you repeat that?
In the T-score section of that, which assesses deliberate attempts to mislead, do you recall? She scored a 60 on that test, correct?
So there are multiple T-scores for each scale, so I'm not sure which scale you're talking about.
Okay. Well, we can deal with that later. So you would agree that you need to follow ethics and best practices in forensic psychology, correct?
Yes.
Okay. And the two primary sources are the American Psychological Association Ethical Principles and Professional Code of Conduct, right? Mm-hmm. And the American Psychological Association's Specialty Guidelines for Forensic Psychology, correct?
Yes.
And Specialty Guidelines 1.02 states that forensic practitioners, quote, strive for accuracy, impartiality, fairness, and independence, correct?
Yes.
Okay. And Specialty Guidelines 1.03 states that you have to avoid a conflict of interest, correct?
Yes.
Now, in addition to not listing the 4 hours you spent with Mr. Depp, Mr. Waldman, Mr. Chu, and Ms. Vasquez, you also did not list that you spent an hour with Dr. Shah, correct?
That's incorrect.
You say that the designation said that you spent
During
an
my
hour-
deposition, I also clarified this. I didn't spend an hour with Dr. Shah. There was an introduction with the attorneys present on Zoom. My time on that call was less than 30 minutes.
Okay. But you still didn't disclose it, did you, in your reports?
No.
Okay. Now, you have not been asked to testify about Ms. Heard's behavior in the context of her relationship with Mr. Depp. Is that correct?
I was asked to testify about somebody's behavioral mental status in general, so that can include behavior involved in a relationship with Mr. Depp, but not specifically.
Can you pull up day 10 of the trial testimony at page 2710? Are you able to do that, Michelle? 2710, lines 12 through 18.
May we approach?
All right. All right.
Thank you, Michelle. Great job. Okay, does the witness also have, okay.
Yep.
So, Dr. Curry, this is your testimony from day 10 in this case, and if you can look at page 2710, line 13. Now, my question was, now, is it your testimony under oath today that you have not been asked to testify concerning Ms. Heard's behavior in the context of her relationship with Mr. Depp, including any abuse? And your answer under oath to this jury that day was, that's correct.
Yes.
Correct?
I
Okay.
still agree with that question.
All right. And you have not made any determinations, including any opinions, that Ms. Heard abused Mr. Depp or Mr. Depp abused Ms. Heard, correct?
Correct.
Okay. And in fact, you said that's outside the scope.
Yes.
Right? Okay.
Of psychology.
And you cannot testify whether Amber Heard suffered any emotional distress as a result of any of the defamatory comments that she has alleged Mr. Waldman made through Mr. Depp, or Mr. Depp made through Mr. Waldman, correct?
Objection, Your Honor.
Do you want me to read my response?
What's
Sure.
the objection? I'm sorry.
What
Hold on, Dr.
sorry,
Curry.
Your Honor.
That's okay. Oh, what's the objection? Are you on approach? Okay.
Now, you have not rendered any opinion as to whether Amber Heard exhibits patterns of behavior that would suggest her allegations of abuse against Mr. Depp are false. Would you agree?
No. I mean, yes, I would agree with that.
Oh, thank you. And you have not, no, that's right. That's all I've got. No further questions.
All
Thank
right.
you.
Redirect.
You were asked about the SCID.
Yes.
What's that?
It's a structured clinical interview. It's for rendering a diagnosis. It's best for treatment because you're asking direct questions of the examinee and about symptoms. So if you have an examinee who has a tendency to minimize, you're not going to get much information.
Why didn't you use it?
Because, well, first of all, I had a limited amount of time for my evaluation, and I had already had to use, just to complete the interview was extremely time-consuming, and I had to even restructure it into handouts so that I could keep Ms. Heard on track. I determined based on that, so this is where you would make an inference. So because I was having difficulty getting direct answers to my questions from Ms. Hurd, I had determined that creating forms of those questions would be a better use of the time, which it was, and then I further deduced that adding on the structured clinical interview would probably be unproductive, given that I had limited time and needed to use the best, most reliable methods for getting information in that time.
You were asked about the APA specialty guidelines,
Yes.
specifically 1.02 and
Yes.
1.03. Have you complied with them?
I have.
No further questions.
Thank you.
Thank you. Dr. Curry, you can have a seat in the courtroom.
you,
You're
Your
free to
Honor.
go. Thank you, ma'am. All right. Ladies and gentlemen, let's go ahead and take our morning recess for 15 minutes. Do not discuss the case and do not do any outside research, okay? All right. Just for planning purposes, Sammy asked Mr. Tobin to be here as early as noon, just in case with the fluid of the trial. I'm not sure what time we can get to that motion, so. That's fine. Okay, just to let you know. They need to work on that. They're going to find out who the next witness is. So let's go ahead and take a recess until 10:55, okay? All right, thank you. Thank you. All right. Are we ready for the jury?
No, Your Honor, we do have an issue we'd like to raise.
Okay, sure. All right, your next witness. I'm sorry, let's get the jury first, right? All right, we ready for the jury? All right, thank you. Are we ready for the next witness, or do you want to?
Yes, we call Mr. Depp.
Okay. All right. So just a reminder, you're still under oath, okay?
Yes, ma'am.
All right, thank you, sir.
Good morning, Mr. Depp.
Good morning.
We heard a lot about some statements that Mr. Waldman made. Do you remember that?
Yes.
And Mr. Waldman is your attorney or was your attorney?
Yes.
Could we please pull up Defendants Exhibit 1245? And this is already in evidence, so permission to please publish. If we could scroll down to the second page. Mr. Depp, do you see the statement here attributed to Mr. Waldman?
Yes, I do.
When's the first time that you saw this statement?
All right.
We can pull the exhibit back up. Thank you. Mr. Depp, when is the first time that you saw this statement by Mr. Waldman?
The first time that I ever saw this statement was in August. It was when the piece was when she August 2020 when I was countersued by Ms. Heard. This is the first time that I saw any of these statements.
Can we please pull up Defendants Exhibit 1246? And this is also already in evidence.
All right.
Thank you. If we could scroll down to the second page, or the third perhaps. Thank you.
Mr. Depp, do you see this statement that's attributed to Mr. Waldman here?
I do.
And when is the first time that you saw these statements?
Same, when the countersuit was filed.
And could we please go to Defendants Exhibit 1247? And again, this is already in evidence. And if we could scroll down, please, thank you. Mr. Depp, do you see the statement attributed to Mr. Waldman?
I do indeed, yes.
And when's the first time that you saw this statement?
This is the same. It's the counterclaim to August 2020.
After you saw these statements for the first time, did you form an understanding as to where they appeared?
I didn't, as to where they had appeared, these statements.
In what publication?
No, off the bat, I didn't know exactly. It just seemed like a lot of word salad to me. I didn't know where they'd come from, or, I mean, where they ended up, or...
Mr. Depp, do you recall Ms. Heard testifying that you did not assist her in getting her role in Aquaman?
Yes, I do, yes.
And what is your response to that? It's not exactly true. Do you know when Ms. Heard first auditioned for Aquaman?
Strangely, I know the date. Well, no, yes, I do know the date, because I was scheduled with my band, the Hollywood Vampires. We had done 2 shows at the Roxy, which is a place in Los Angeles, to rehearse for we were invited to play at the Rock in Rio concert, which is a huge rock and roll festival. So we did the 2 shows to go to Rio and play there. Miss Heard wanted to come with me, and Whitney, her sister, had come as well. While we were there in Rio, we were rehearsing, getting ready for the show. Miss Heard informed me that she would have to get back to Los Angeles for an audition, meaning it's basically after our 2-hour show or whatever, we would have to get on the plane immediately to make it back to Los Angeles for this audition. And that audition was at Warner Brothers. It was whatever film it was.
And when were you performing at the Rock in Rio?
Oh, sorry. Yeah, that was I believe it was the 24th of September.
In what year?
That was 15.
What do you understand happened after Ms. Heard auditioned for Aquaman?
After Ms. Heard's audition, or possibly auditions, for Warner Brothers and I suppose the creative team, Ms. Heard expressed to me that the film was going to be, Warner Brothers had said that the film was going to be shooting in Australia. And Australia was for Ms. Heard, that was a potential problem, which...
Objection, Your Honor. We approach.
Okay.
I apologize, Mr. Depp. Could you please continue? What happened after Ms. Heard auditioned for Aquaman?
I was informed by Ms. Heard that the film was going to be shooting in Australia, and that was of concern to her, and because it was of concern to Warner Brothers. So she asked if I would, because I'd had a multi, for a few years I'd had a multi-film deal with Warner Brothers, and so we'd been in business together. So I knew these people. I'd been on films with them. So she asked me if I would speak to them. I made a phone call and I spoke to.
Objection, hearsay, Your Honor.
I don't believe he said anything. I think he was going to say who he spoke to.
All right, we'll see. Overruled at this point.
I spoke to the three upper echelon Warner executives, Kevin Tsujihara, Sue Kroll, and Greg Silverstein. And I told them that...
Objection, Your Honor. Hearsay.
All right, I'll sustain the objection. Next question.
What was the result of you speaking with those individuals?
Well, I can only say that ultimately she did get the job in the film. So hopefully I suppose I had curbed their worries to some degree.
Mr. Depp, do you recall Ms. Heard testifying that she saw you consume 8 to 10 MDMA pills while you were in Australia in March of 2015?
Yes, I do remember that.
How many?
I also remember her saying that I took a handful.
Objection beyond the scope. Question.
Sorry, that was extra residue.
All right, I'll sustain the objection. Next question.
How many times have you done MDMA in your life, Mr. Depp?
Actually, not that many times. I would say in my lifetime, maybe. In my lifetime, MDMA, 6, 7, maybe.
And how much MDMA have you done on those occasions?
Not enough to properly. Well, not enough to properly experience what the chemicals are supposed to do to you.
Have you ever consumed 8 to 10 MDMA pills at once?
No, ma'am. No, I have not.
And why is that?
Because I'd be dead. I'm pretty sure I'd be dead. I think one would die, yes, and probably rather quickly.
Mr. Depp, I'd like to show you some pictures from the home in Australia that Ms. Heard testified about.
Sure.
Could we please pull up Defendants Exhibit 1817, which is already in evidence? Mr. Depp, do you recognize what's depicted in this photograph?
Yes, I do. That's the downstairs bar of the house we rented in Australia.
And can you please show the jury where you were sitting when Ms. Heard threw the 2 vodka bottles at you?
If I touch this thing, it'll make a
Yes,
mark.
it will.
Yes. Okay. So this chair, that one here, was over here. And it was in pretty much when I was turned around they were on a swivel, so when I was turned around towards the bar, I'm facing the bar. When I turned around this way, this chair here was in pretty much exactly this same position as this chair. It was when I was facing Miss Heard, who was, let's say she was, if you're looking at the photograph, she would be about here.
Could you draw a line in the direction where Miss Heard was relative to where you were sitting?
Yes, absolutely. So if I'm sitting here, she was over here, like back here.
Approximately how far away from Miss Heard, from you was Miss Heard, if you can recall?
I would say it was probably 10, 12, 15 feet, maybe 10 feet, 12 feet.
And approximately where was your hand when the vodka bottle hit it?
It was leaning. My arm was leaning on the marble bar, right there where the imaginary seat is, and leaning, kind of just leaning back and looking at Miss Heard. She just walked away with the second bottle. I mean, she walked this way when she threw the first bottle, which is actually visible in the background on the floor.
Yeah. Could you please circle where the first bottle is?
Oh, sorry, excuse me. Yeah. All that is the exploded first bottle that went past my head. And the second bottle hit right up here where my hand was resting on the marble bar.
Can we please pull up Defendants Exhibit 1820? Mr. Depp, do you recognize what's depicted in this photograph?
This is behind that very bar.
And what do you see on the floor in this picture?
I see what looks to me like some kind of napkin. It looks sullied, soiled, blood, I don't know. And I see glass in the corner, blood obviously on the floor, and a towel leaning up on something.
Do you know how that bloody tissue got on the floor?
My best guess.
Objection calls for speculation.
Sustained?
Do you know how the blood got on the floor, Mr. Depp?
I know how the blood got on the floor. It came from my dripping finger. So that's why the tissue is I'm 99.9% sure, since it is, looks like it's got blood on it as well, is what I held my finger with.
Do you see the wall on the left side of the photograph?
I do.
Was there a wall-mounted phone on that wall?
On the left side of the photo? No, I didn't. No. Not that I recall, no.
Could we please pull up Defendants Exhibit 394, which is already in evidence?
Yes, ma'am.
Mr. Depp, do you recognize this text message?
I do.
And what is this message?
It's a text to Dr. Kipper. I'm sorry, just reading through. Yeah, this is my text to Dr. Kipper, who had just happened to be in town, telling him that I've had it and that I just lost a fingertip.
How long after your finger had been injured did you send this text message, if you can recall?
It's hard to tell because when I look at the timestamp, it says delivered 3/7/2015, 5 o'clock. But I know that because of Australia time, it was the 8th, and it was probably, the whole thing lasted probably until about 2 p.m. Or so, when that was when Kipper was called, Jerry was brought in, Jerry Judge, sorry, excuse me.
So do you have an estimate as to how long after your finger had actually been injured that you sent this message?
I don't think it was very long. I think it was probably within the next, I'm sure it was in the next half hour or so. I would have had to sneak into a bathroom, lock myself in to type this out.
And how were you able to send this text message to Dr. Kipper in the state that you were in?
Well, he wasn't available at the time, so just sort of thumb your way through, don't you?
How long after sending this text message did you see Dr. Kipper?
I don't recall it. I think it took them probably 30 minutes or more, 30 to 40 minutes to get there.
And what did Dr. Kipper do when he first arrived at the home?
Oh, the first thing he wanted to do was inspect the damage of my finger and try and figure out exactly what had happened, how it happened.
And what did you tell Dr. Kipper about how your finger had been injured?
Objection, Your Honor.
May we approach?
Hearsay.
All
We've
right,
discussed
that's
this
fine.
several times.
Let's go.
Mr. Depp, when Dr. Kipper was treating your finger, what did you tell him about how your finger became injured?
I told him that there was obviously, I mean, when you saw the damage in the house and everything, and the blood everywhere, I mean, obviously there was serious damage done. There would be no point in lying to the man. He'd been through it with me and Ms. Heard before. I told him that she had thrown a bottle of vodka and smashed and cut my finger off, the tip of my finger, but a good chunk. I miss it.
Mr. Depp, you heard Ms. Heard testify about an alleged incident of abuse on your honeymoon. Do you remember that?
I remember her testifying to that, yes.
And when did you and Ms. Heard go on your honeymoon together?
I believe it was somewhere in the neighborhood of August, because I had just finished the film. Maybe end of July, August. I'm not quite good on the exact date.
Do you recall the year?
It was 2015, I believe.
And where did you and Ms. Heard go on your honeymoon?
We took the Orient Express from Bangkok, Thailand to Singapore.
And what happened while you and Ms. Heard were together on the Orient Express?
There were times when it was very agreeable, very nice. And then there were times when something had become dissatisfactory for her, and she would start the rant, the blooming of a fight would be on deck there, and at one point it didn't. I mean, I don't remember it lasting long at all. I just remember that I took a pretty good shot to the face, to the eye, to somewhere up here. So I had a bit of a shiner. But it all ended, and then everything got fine again, and we'd go to dinner, and it was all fine.
Did Ms. Heard ever apologize to you for giving you the shiner?
I don't recall.
Can we please pull up Plaintiff's Exhibit 162, which is already in evidence? Mr. Depp, do you recognize this photograph?
I do. It was with the chef and the maitre d' and the staff were asking if they could take a photo with us, and they'd been very kind. They'd given us a private dinner card.
So where was this photograph taken?
That was in the, that looks like it's in the, yes, that's towards the back of the Orient Express. That's in the back train bar compartment. And just out back, you could smoke on the sort of caboose or whatever.
And what, if any, injuries do you have in this photograph?
I think the eye's a little bit bugged out, if you will. It's, yeah.
How did that happen?
These things could happen very quickly if you disagreed
Objection, Your Honor, non-responsive. She just asked, how did that happen?
I believe he was about to explain.
Well, I'll sustain the objection.
Okay. So, Mr. Depp, specifically, how did the injury in this photograph occur?
I'm sure it hit me. Is that better?
Does this picture accurately reflect what you looked like on that date?
I don't look at myself much, but it certainly looks like me with a black eye.
Does this picture appear to have been photoshopped in any way?
No, I think it would be difficult to photograph or to start getting into sort of digital processing with a number of people in the shot, especially in a wide shot.
Could we please pull up Plaintiff's Exhibit 1301? And this is a new one, Your Honor, so this is not in evidence.
Okay, thank you.
Mr. Depp, do you recognize what's reflected in this photograph?
Yes, this is the staff. It's the manager and his staff at the Raffles Hotel in Singapore. And before we left, they asked if they could take a photograph with us.
And when was this photograph taken?
Well, that would have been, we were off the Orient Express. We stayed in Raffles, I believe, a couple of few days. And then from there we flew to San Francisco.
So this photograph was taken after the photograph we just looked at?
This photograph was taken after the photograph in the dining car of the train, yes.
Your Honor, I'd move Plaintiff's Exhibit 1301 into evidence.
All right, any objection?
Oh, happy honeymoon. So
Any
31st of October.
any objection?
No objection, Your
All
Honor.
right, 1301 is in evidence, can be published to the jury.
Mr. Depp, what, if any, injuries do you see on your face in this photograph?
I see pretty much the same. I see that the area in here has been is swollen and yeah, there's a bit of a shiner there.
Thank you. We can take this down. Mr. Depp, do you recall Ms. Heard testifying that she punched you in the staircase incident because she thought of Kate Moss in the stairs?
Do I remember her saying that?
Yes.
Yes, I do. 3 times. Yes, I do.
Do you have any understanding as to what Ms. Heard was referring to?
Yes, I do.
And
as Kate Moss, Kate testified, it was many, many years ago. And exactly what happened is what she said happened. I recall speaking with Ms. Heard about that very incident because of the downpouring of rain, because it was raining very heavily that day that Kate slipped. And I recalled the story to her.
Objection, Your Honor. Hearsay.
May we approach, Your Honor?
Okay.
Please continue, Mr. Depp. What did you tell Ms. Hurd about the staircase, or Kate Moss?
I'll make it easy for Mr. Rottenborn. Ms. Hurd took the story and turned it into a very ugly incident, all in her mind. There was never a moment where I pushed Kate down any set of stairs, yet she's spewed this 3 times before.
Objection, Your Honor. Ms. Hurd simply testified that she had heard a rumor, and that's
What's a rumor?
non-responsive to the question.
Sir, hold on. This
Sorry.
objection. I'll overrule the objection.
Misstates the facts and evidence.
I'll overrule the objection.
Sorry, I was drawn by Mr. Rottenborn's voice.
Certainly.
What was you? What was it?
So what specifically had you actually told Ms. Hurd about the incident with Miss Moss and the stairs?
Very simply that we were in Jamaica. I had left our bungalow about 3 minutes prior to her. I was standing outside, and suddenly rain starts just coming down like it's, monsoon. And then I remember looking and seeing Kate coming out the door, and there were 3 little wooden stairs, and she slipped, her legs went up, and she landed directly on her coccyx and her lower back. So, and she was obviously physically in pain, and she was hurt, she was crying. So I ran over and grabbed her to make sure she was all right. That's it. That's all I ever. That's the whole story. But then the rumor of it, I'd never heard a rumor of that before Miss Hurd grabbed hold of it. It's like that. Sorry.
Mr. Depp, we heard testimony from Ms. Hurd's sister, Whitney, during this trial. Do you remember that?
Yes.
And how would you describe your relationship with Whitney when you were in a relationship with Ms. Hurd?
I liked Whitney very much. Initially, when I first met her, I liked her very much, and grew to love Whitney very much, because I always, it seemed, Whitney, Amber's sister, Whitney, seemed to always get the sort of dirty end of the stick, and I felt bad for her for that, because it wasn't new. It had been there for life, and that was seemed pretty obvious. So I took to Whitney very, very quickly, very easily. She was a very sweet kid. She was wonderful.
What do you mean that Whitney got the dirty end of the stick?
It was a kind of a strange combination of loving sister, trusted sister and friend, and then lackey, and then, either the punching bag or the dartboard, or the recipient of some rather demeaning and ugly words, or she would have wine thrown in her face.
And who was the source of those demeaning words and the wine that you just referenced?
Well, that would be Amber Heard, her sister.
And how do you know that?
Well, I witnessed quite a lot of it. The wine in the face was something that happened in New York, which I think that even made it into the papers. I believe that even made it into the papers. It was in an elevator.
How did you first learn about that incident?
Miss Hurd told me in detail.
What else did you observe of Miss Hurd and her sister Whitney's interactions during your relationship with Miss Hurd?
They were just constantly up and down, but I could sense, I could feel that Whitney was trying to please her sister, trying to be up to snuff, and it just seemed like she got shot down.
Objection, Your Honor. This has gone beyond the scope of the question or his foundation for knowledge of that.
Your Honor, I asked what he observed, between them. I think this is responsive to that.
And his testimony as to what Whitney felt is.
I'll sustain the objection. Next question.
Okay. Did you ever see Miss Hurd physically attack Whitney?
No, I've never seen any full-on blowouts, physical blowouts between them. Tons of verbal blowouts.
Objection beyond the scope.
Overruled.
I've certainly seen Miss Hurd grab Whitney, push her around. There were a number. There were half a dozen times when some of us, whoever was in the general vicinity, would have to leave. This is at Orange, when Whitney and Amber were living at Orange. Whitney and her boyfriend at the time, Sean Krajewski, and we had to leave the apartment and wait in the car while they fought.
And when you say fought, do you mean
Physical.
physically or?
Physical.
And when you said Miss Hurd would push Whitney around, do you mean that to physically push her or metaphorically?
Both.
You heard Whitney testify that she lived in Penthouse 4 at the Eastern Columbia building for a time, correct?
That is correct, yes.
How did Whitney come to live in Penthouse 4?
My recollection when Whitney first came to stay at the Eastern Columbia building in Penthouse 4 was she and her boyfriend, Sean, had broken up. And she needed a place to go. And so Amber asked if she could stay in Penthouse 4, and I said, well, of course, of course, you know.
How long did Whitney live in Penthouse 4?
It was well over a year, on and off.
Did you ever ask Whitney to move out of Penthouse 4?
No, I did not, no.
Why did Whitney ultimately move out of Penthouse 4?
Objection, foundation.
It's his apartment, Your Honor. He was living there.
Oh, overruled.
Whitney moved out of Penthouse 4 long before the marriage, and it was due to an argument that Ms. Hurd and Whitney had, which had to do with Whitney working at the Art of Elysium with Jennifer Howell and those people. And Amber asked her to leave. get out.
Where did Whitney live when she moved out of Penthouse 4?
My understanding is she went to live with Jennifer Howell.
Your Honor, I know you anticipated having a motion at noon.
You can keep going, that's
Okay.
fine. We can. How much longer in direct do you have?
I have a bit.
Okay, that's okay.
Mr. Depp, do you recall hearing testimony during Ms. Heard's case from Mr. Mandel?
Yes, I do.
And who is that?
Mr. Mandel is my former business manager of 17 and a half years, who at a certain point I discovered had been embezzling quite a lot of money. So I had to take action against him and he and my lawyer of 17 and a half years, as they were in cahoots, as it were. And so yes, Joel Mandel is, and they settled their case with me. They made their settlement. But yes, it was the big. That was a very, yeah. Joel Mandel is a very bitter man who ended up with a lot of money that I worked hard for over the years.
Do you recall Mr. Mandel testifying in this case that you do not spend very much money on charity?
That I don't, sorry?
That you do not spend very much money on charity?
Objection, Your Honor.
You just want to
Can we
approach?
approach?
Okay.
Mr. Depp, just to remind you, my question was, what is your response to Mr. Mandel's testimony that you do not spend very much on charity?
My response to that is Mr. Mandel is a very bitter man, and one thing about that, myself personally, with regard to charity donations, sending money to a charity, I prefer, I would rather that my name were not on it. I don't want the name to be the important thing or the thing that people talk about. So when I donate money, I donate without my name being involved because I don't see that that's important, my name being there in terms of money. Now, if I am able to visit hospitals, or if I'm able to meet with Make-A-Wish children, have held on to the relationships that I've held on to within the Make-A-Wish Foundation and the Children's Hospital and various other places. Then obviously my name is involved. When we held premieres in Leicester Square for several films, Charlie and the
Objection, Your Honor.
Chocolate Factory.
Again, beyond the scope of his response to Mr. Mandel's testimony.
I believe this is in response to Mr. Mandel.
I'll overrule the objection.
So basically, when it was a public, let's call it a donation or whatever, I would talk to the studio. I would talk to Disney. I would talk to Warner Brothers. I would talk to whoever the studio was, well before the premiere, and make the premiere a benefit that would, once we did what we benefited, we did a benefit premiere for Great Ormond Street Hospital. We did a couple of benefit premieres for the Make-A-Wish Foundation. I mean, if you can turn a premiere with that many thousands and thousands and thousands of people there into a benefit, it works and it helps, but it wasn't presented under my name, you know. It was Disney's doing this or Warner Brothers is doing this. I'm not looking for the pat on the back, as it were. If I can make it happen, great, but I don't need the pat on the back. I don't need the adulation. I don't need the attention.
Did you hear Ms. Heard testify that one of the charities she donated a portion of your divorce settlement to was the Children's Hospital of Los Angeles?
Yes.
What is your relationship with the CHLA?
Objection, Your Honor. Irrelevant to the issue.
May we approach Your Honor?
Yes, ma'am.
Mr. Depp, what is your relationship with the CHLA?
I've had a relationship with the CHLA for probably 20 years or so.
And what's just the nature of that relationship?
Well, essentially, you know, sometimes there are Make-A-Wish kids who are in the hospital there, and that their wish is to.
Objection, Your Honor.
Your Honor, may we approach?
Okay, sure.
Mr. Depp, I'd like to take you back to exactly 6 years prior to this week, the week of May 21st through May 27th, 2016. What happened at the beginning of that week?
May 21st.
Excuse me, May 20th.
May 20th. We're talking 2016 here.
Yes.
May 20th, the afternoon of May 20th, afternoon, evening, my mom made her exit. She'd been fighting cancer numerous times and for many years, and she fought all the way to the end. And so my mother passed away on the 20th of May. Which does bring instant perspective into one's mind. I spoke to Amber that night. I called her on the telephone, explained to her that my mom had passed, Betty Sue had passed, and that I thought that the best thing we could do was to that I filed for
Objection, Your Honor.
divorce.
Hearsay. What Mr. Depp told Ms. Heard.
We can move on, Your
Okay,
Honor.
yes, ma'am.
Mr. Depp, what happened at the end of that week on May 27th, 2016?
May 27th, my daughter's birthday. May 27th, I was not in Los Angeles. I was on the way to on tour, and that was when Miss Heard went for the restraining order. And oh yeah, also that was the day that Alice Through the Looking Glass, a film I'd done, was opening.
Did Ms. Heard know that you were out of town on May 27th?
Yes.
And how would she have known that?
Well, I told her I was going on tour. I mean, that was well established.
How long were you going to be out of town on that tour?
2 to 3 months.
And did Ms. Heard know how long you'd be out of town?
I don't know if she knew exactly how long I'd be out of town, but it was a pretty extensive tour of Europe.
How did Ms. Heard's actions on May 27th, 2016 affect you?
Changed everything.
Objection, Your Honor.
Oh,
Relevance
it didn't change
of this
everything?
lawsuit.
Sorry.
Mr. Hurd, if you could wait till the objection, please.
Yes, I'm sorry.
Relevance.
Tourette's.
Your Honor, this is one of the key
If you want to
dates.
approach. Let's go.
Mr. Depp, what has it been like for you to listen to Ms. Heard's testimony at this trial?
I'm sorry?
What has it been like for you to listen to Ms. Heard's testimony at this trial?
Objection, relevance, Your Honor.
Oh, overruled.
Insane. It's insane to hear heinous accusations of violence, sexual violence, that she's attributed to me, that she's accused me of. I don't think anyone enjoys having to split themselves open and tell the truth. But there are times when one just simply has to, because it's gotten out of control. Horrible. Ridiculous, humiliating, ludicrous, painful, savage, unimaginably brutal, cruel, and all false. All false. I wanted no human being is perfect, certainly not. None of us. But I have never in my life committed sexual battery, physical abuse, all these outlandish, outrageous stories of me committing these things and living with it for 6 years and waiting to be able to bring the truth out. So this is not easy for any of us. I know that. But no matter what happens, I did get here, and I did tell the truth, and I have spoken up for what I've been carrying on my back reluctantly for 6 years.
Thank you. No further questions.
All right. Did you want to take lunch at this point, or just, okay, all right, let's do that. All right, ladies and gentlemen, let's go ahead and take lunch this time. Do not discuss this case with anybody, and don't do any outside research, okay? Thank you. And don't break anything on your way out. Thank you. Thank you. All right. So just a reminder that since you are back on the stand, do not discuss this case with anybody, to include your attorneys at this point, okay? If you could just have a seat back there. We do have some other issues to take care of. Before we take care of the third-party motion, could I have the attorneys come forward on our